Thank you for your kind interaction. Good afternoon, dear colleagues. We know also from the previous session that treating liver lesion could be definitely a challenging task. Because, of course, our target is moving, because the rib cage is, of course, closing us the window, the open window that we can use to reach our target. Within the European 7-frame program project TRANS-FUSIMO, a novel software being developed to try to assist liver treatment lesion by the use of MR-guided Focused Ultrasound. Actually, there is a preclinical ongoing trial before, of course, translating this result into humans. And in this trial, we are trying to induce and generate predefined necrotic lesions into a healthy pig liver. This is the TRANS-FUSIMO working treating software. It's much more complex than that, but it is at the physician level, so at my level. So we have a workstation that allows us to take full control of the MR for both planning, for device tracking, of course for pre and post treatment imaging. And on the other side, this workstation is connected with a focused ultrasound system and allow us to control each single sonication parameter. The trial is actually ongoing, as I told you, and this is the design of the study. It will include the 30 pigs, 30 large white swine. And today I'm going to show you only an example about the phase 1 acute phase treatment, where with the aim to assess which kind of necrotic lesion we are able to induce in an acute patient. All treatment have been performed under ventilator-controlled breathing. Of course, the animals are sedated and intubated, and we used a prototype non-clinical version of the InSideTech conformal bone system. It's called the ICBS. This is integrated with a 1.5 clinical MR system from GE, and for an optimal imaging we use the MR instrumented duoflex coils that are very useful for interventional radiology, MR interventional radiology. The imaging protocol includes, but it's not limited to, the sequences that you can read it. Of course, we have imaging to check the liver before the treatment. We have sequences to identify the transducer, the location of the transducer, then to plan the treatment. And at the end, of course, after the monitoring session and the sonication, we have to run a few conventional imaging to check the lesion. In the picture, you can see one of the session, the ICBS is this round transducer over here. The white ring is one of the coils we are using. Then everything is a little bit stuck to the belly of the animal with those two blue belts. This is a screenshot from, actually is a videos from one of the session we had. In the lower left corner, you will see, once we will start monitoring, we will see in real time the images that are transferred from the MR to the TRANS-FUSIMO workstation, and the API imaging will start appearing here, and you will see the liver moving up and down. Of course, this is the water-filled membrane, so the transducer is over here, and after a few scans, the system will identify the bright spots from the vessels inside the liver, has some very good tracking, and he will start the motion compensation algorithm. And when we will start the sonication, we'll see, of course, could you please start the videos? Here we go. So you will see a few pop-ups come down when we have, it's going, doesn't look. Okay. So once the system is ready, the MR waits for a pulse to start the scanning, and the API imaging is with the windowing, the MR imaging is appearing. You see the liver moving. The systems now will recognize the bright spot as tracking spot for the motion compensation algorithm. We start the sonication. In this case, as you can read, is a 150 watt sonication for 60 seconds. The temperature is starting to rise from 37, 38 to this baseline. It's growing 15 degrees from the baseline. Now we are approaching 20 degrees. And as you can see, everything is working good. But of course, even if the temporal rise is already in the range of tissue lesioning and tissue ablation, we have, of course, to check what we have done with some post-treatment, post-procedure MR imaging with gadolinium. You can see the necrotic lesion into the red circle in this picture from the lava, post-contrast lava sequence. And of course, then we move, the animal is sacrificed in this phase. We check with a macroscopic inspection. The lesion in this case is almost a superficial lesion that is extended for up to 2 centimeters deep into the liver parenchyma. And on the H&E staining, you see the typical findings with cell swelling and karyolysis, and that are all we are used to see into a necrotic lesion by rapid denaturation of the cellular proteins and all the stuff that you definitely know better than me. I'm not a pathologist. So we have been successful in having some liver lesioning using our system on both breath hold. That is much easier, as you can understand, but under ventilator controlled breathing, using the compensation algorithm to move the focal spot according to the live MR imaging that are scanned during the sonication. And during all the preclinical session we had, of course, the multi-reference thermal monitoring was used and the full workstation was used. And in conclusion, we know that the trial is still ongoing, so maybe is still subject to further optimization, but this preliminary result looks very promising for us. I trust it looks promising for you too. And right now we have been successful in confirming the lesion by both MR imaging and histology inspection and staining. And so right now we can say that this system was capable to compensating the liver motion under ventilator-controlled breathing with real-time MR thermometry and real-time FUS beam steering. Please let me thank all the people that are behind such a complex project. There are a lot of people working on this. A few of these guys are here. We have 3 posters in the poster station, so if you have some technical question about the big amount of things that I haven't reported in this short presentation, please find us in the poster station, and thank you for your attention.
I think in the interest of time, we actually, do you have a quick question? No. Yeah, in the interest of time, we have to move on. So thank you very much, and we'll meet you at your poster.